My name is Dr. Sartie Kenneh. I'm the Chief Medical Officer for the Ministry of Health and Sanitation in Sierra Leone.
Dr. Kenneh, what has inspired you about the forum and this community so far?
Well, it's the fact that like-minded people, so many, that are global leaders in global health with concern, are gathered together to focus on one burning issue that is actually something we can handle, but has not been handled. And in the midst of opposing and crisis, be it medical, economic, and other things, and the very fact that we know the answers, we know the problems, but to hang heads together, come with one voice, and gather together, get one single effort, so that when everybody goes back, you implement it or push forward the thing. That's an inspiration, with the fact that our children will be surviving, hopefully.
That's wonderful. Could you talk a little bit about the child survival actions and Sierra Leone's commitment and the announcement that will be made today?
Yes. In Sierra Leone, we don't have an alternative. We have to move on and move forward with child survival action, because what we have in our countries is unacceptable, more so when you have something that you can actually control or prevent. And realizing that we are focused on more vertical issues and then do very well in one area, and then the same child you've saved somewhere dies of another something, makes it more frustrating and makes you look funny. So having a child survival action that will really look at the child in a focused form with patient-centered care approach, with all partners and the possibility of the highest level of commitment in governance and all other levels in the country, and the fact that, like what we saw that even our global and regional partners are aligning now, because the key word is there has to be alignment for us to break down those vertical things and look at the child as a holistic one with the aim of saving that child.
Anna, did you want him to say anything else about it? Is that okay?
No, I think it's fine. Good. Thank you.
That was great.
Yeah.
One more question.
Okay.
When you return home to Sierra Leone, what is one thing that will change as a result of the forum?
The thing that will change as a result of the forum is the governance part of it in the ministry. That's the number one thing, and that's what I will push first. Is actually as it is now, we have a child EPI and child health program. We'll divide that immediately as we go down, so that we'll have a child health focused program, set it up to work, but not in silo, to really align the new plan that we've developed with all other existing programs, and then leverage the current programs going on as we are doing grants making for others to see how we can also align, so that support will be given to this, because we cannot work alone. And is that we have an opportunity. We already have fora in our country dealing with outbreaks. We have the One Health Forum that brings on education, brings on agriculture, brings on environment and water resources. And looking at the things that damage or kills our children actually lies within all these ministries. So we'll use that platform and bring on board the child health and child survival issues on it, focus together, align these things together, and see what that can bring us.